Kathy, you have to unmute yourself.
There we
Kathy?
go. Yep, I'm here. Good morning. This is Kathy Way. I'm the, I was the director at the Division of Child Protection Services in Delaware for 5 years, and also was Assistant Commissioner in the state of New Jersey for the Children's System of Care, which was a child behavioral health system. And I'm pleased to be part of this group, and thank you very much.
Next, Kyle Hodges.
Thank you, Taylor, and thank you for sending that link to me again. My name is Kyle Hodges. Good morning, everyone, and I'm the Policy Director for the State Council for Persons with Disabilities.
Next, we have Maria Matos.
Good morning, everyone. My name is Center, and I'm also a member of the Delaware Hispanic Commission, among other things. Thank you for having me.
Dr. Devonna Williams.
Good morning, everyone. I'm principal of Goins Williams Associates Performance Consulting. I also chair the Board of Trustees for Delaware State University, and I am working as a Delaware liaison for the Mid-Atlantic Association of Community Health Centers.
Susan Sizik.
Hi, good to see all of you. I'm a resident of the city of Wilmington. I'm currently retired. I spent 15 years, as Kathy did, over at the Delaware Children's Department. And before that, spent the bulk of my career, like 25 years, in the nonprofit community in the state.
Corinthia Pierce.
Good morning, everyone. My name is Corinthia Pierce. I am a retired state employee, 30 years, retired from Department of Labor, but also background in Delaware Health and Social Services. I'm now a consultant.
Bennett Connolly.
Yeah, I'm Bennett Connolly. My career was I was director for the Department of Children, Youth, and Families in Maryland, and then director for Health and Human Services for a period. My volunteer work in Delaware since I moved here is I started the Community Resource Center in Rehoboth. We're serving 18,000 people now a year. And I'm also president of the Greater Lewis Community Village, which I started 4 years ago.
Crystal Mills Selby.
Good morning, everyone. My name is Crystal Mills Selby. I am a human services professional with specializations working with the aging population and disabled populations, and I'm just happy to be able to be a part of this group.
And I believe Mr. Jester just joined.
Hello, my name is Rich Jester. I'm currently a vice president of JPMorgan Chase, specializing in software and data management for enterprise level. I also bring a lot of policy writing experiences related to the community and education, healthcare, and energy. So I bring data analysis and more kind of structured IT experience to this to see how we can best serve our consumers through technology.
Thank you. Thank you, Taylor, for that. And thank you, everyone, for your reintroduction, since it's been a long time since we've been together. And so the agenda for today, I sent out the minutes. I think we have also posted those, have we, Taylor?
They will be posted once approved.
Okay, thank you very much for clarification. So if at this time, if you had a chance to review the minutes, may I have a motion or a discussion relative to any edits or changes or needs for the minutes? If not, if we could make a motion to accept and approve the minutes.
Make the motion that we approve the minutes.
Second.
I'll second.
Thank you. All in favor?
Aye.
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 Okay, thank you. The minutes are approved and accepted. At this time, we are going to do a couple things. One is Susan Sizik has graciously agreed to go through all of the past minutes and to roll up any outstanding items that we might need to ask of the department and all the division directors that presented, or any outstanding data that we need, as well as recommendations. She's going to tease out the recommendations and summary consensus that we as a group came to as far as making recommendations to our final report. And so she will create a document and then we will circulate that to everyone. So Susan, I want to thank you in advance because that's some work to do. So I appreciate that. At this time, I would like us to move into the agenda of presenting the slide, a PowerPoint presentation of the results of the survey, a synopsis of that. It is not finalized. It does not have a conclusions. As a group, I think we will forge those conclusions. And I also need it. So it is in a draft form at this point, and it's a preliminary presentation. And so I would like to walk through that with everyone. And please ask questions as we go along, provide comments or make suggestions. We will reserve public comment to the end for the when we open it up to the public good. So is that basically, Taylor, how we should do this? Open it up to the public good at the end?
Yes, I believe there is time reserved on the agenda for public comment.
Okay, thank you. And is there anyone in the queue for that or not? Can you see?
Not as of now, but I will
Okay.
alert you.
Okay, that I appreciate. Thank you very much. Okay, so with that, we will begin. And you can go beyond this slide because we're going to delete this one. I was able to go with that. So everybody introduced themselves. At this time, I'm going to ask Devana to walk through the process that was used and around the survey. Thank you.
Okay, good morning again, everyone. Well, as you know, we decided to go to an online survey to solicit feedback from consumers. And we started by asking who we wanted to reach. And our effort was designed to reach those that we had not heard from previously. And so we wanted to get as broad a response as possible. It was not a randomized survey in that we did not select out respondents so that we would have a statistically valid sample or response. We did send to anyone who we thought would be able to provide a response. So we constructed a 10-question survey that was distributed by email. We used SurveyMonkey as the platform. We sent it online to those individuals that were identified, those organizations and individuals that were identified first by our committee and task force members. And we also asked the Secretary of the Department of Health and Social Services to forward that link to the departmental employees and other state employees. And so some people forwarded those on to others, and that's how we were able to get responses. The questions were open-ended. It was designed to have more of a qualitative response to get people's opinions, but we did limit their responses to 25 words. So it was possible for us to consolidate and review all of the information that we received. Responses were confidential and anonymous. So we also assured people who responded that their information would not be shared with anyone by name. And of course, the survey response was voluntary. It was administered over a 2-week period. And the intent of the survey was really to augment our other work that we had done. Perhaps we would use this information to follow up with focus group or other public meetings, as well as to augment the work and information that we already had received. As already mentioned, the results are not statistically valid because of the way we went about the survey. And again, the results are intended to be a guide for our further study and information. But we were pleased with the response overall, and I know that Ann will talk some more about that. Okay. Thank you. Do you want me to continue on with this?
Yes, please.
So as was mentioned, each of the responses was limited to 25 words. There were only 10 questions. And the questions are, what are the gaps in health and social services in your community? What services are needed, if any? How do you, if family members, neighbors, or those you serve, access services? And what barriers or obstacles are you aware of that people have in getting the services they need? What affects you, your family members, neighbors, or those you serve, to the ability to access services, and what can be done to make sure people get the health and social services they need. We also asked for a little bit of demographic information, including zip code, age, and gender identification. And then we also asked our respondents to state whether they were consumer, client, advocate, nonprofit, provider, or other community group representative, or DHS employee, or other state employee, or other government employee. So that's those are the questions. And basically this was a gap analysis. We were trying to identify what the gaps are, what the barriers are, barriers and obstacles, and gather some other information as you see here. The next slide. So you can see the distribution of respondents by age. And here what this is showing us is that the largest blocks of respondents were older, ages 55 to 64. And you can also see the 45 to 54, the dark blue respondents. The least amount of response we have is from the group of the 18 to 24-year-olds. So if we were looking at this again, we say, well, we really want to learn more about what people in that age group, what they see are barriers and barriers to access and other issues that they might have. Okay, next slide. So gender, as you can see, and probably not surprising that more than 3/4 of the responses were from females and about 20% from males. And we have others or people that didn't identify themselves. So, you know, again, we would probably want to know a little bit more if we could about males, but this also probably maps closer to the population of people receiving services as well. And then here you see a distribution of respondents by zip code. So you're able to see, and you can enlarge the slide a little bit, but you can see that we have distribution statewide in our overall responses, but we are missing some areas, some zip code areas where we don't have as much response. So again, if we were going back out, we might want to look at, well, more responses from the western part of Sussex County, for example, and the lower part of Newcastle County. Okay, next slide. Thank you. And again, you can see respondents by group. And what's really interesting about the responses that we received, and I didn't mention that we received almost 500 responses overall. And you can see that about half of our responses were from DHSS employees. But we didn't realize we would get that amount of a response. I was just quite a surprise. But the good news here is that a lot of the respondents who were DHSS employees were also people who were working frontline with clients. And so we feel that it's still very informative, the information we received there. And then you can see the other breakdowns, consumer and client, consumer or client, that's the next largest slice of the pie here. And then the gray area that you see, that is other state of Delaware employees. And the yellow slice are the nonprofit providers, and they're almost equal here along with the other governmental employees in blue. The next slide, please.
Can I ask a question?
Certainly.
Back to the number of surveys you have by county. What do you attribute to such the low number in Sussex County?
It could be a lot of reasons. I can tell you from the work that I do, it's always hard to get people to respond. And it depends on the agencies that are doing the outreach. So in this case, we asked nonprofit organizations to reach out to their constituents and government services the same way. And then people are skeptical about replying to surveys. And we also have barriers for people being able to have access to the internet, as we know. We have some, I'll call it internet desert areas or Wi-Fi areas. Sometimes people just are not able or not familiar or do not know how to actually access a SurveyMonkey instrument to take the survey. So it could be all of
And
those.
speaking,
We don't know.
and just to add a little bit to that, and speaking from experience, just because all of us know how to click on a link and then go and fill in some buttons, that doesn't mean the average person knows how to do that, has access to that, or as she says, is in an area where that link will even work. So, I think that what's come out of this and the way she's organized this data is really, really good, because it's the way I would organize it personally. But we just have to be realistic about the limitations of the survey, and not everybody is going to be as tech savvy as the people on the committee right now.
Absolutely, absolutely. And I would just say, exactly as Richard has said, everyone does not know how to use these different tools or use links, or know how to respond, where to put the information in the little blocks, for example. And some of it's tied to education, some of it's tied to whether or not people are familiar in using these tools on their job or in their school. This period that we've recently gone through with the pandemic, more and more people have become familiar with using remote tools and surveys and things. So it might be interesting if we had an opportunity to go back out to see if we would, or perhaps even just have people respond directly in an email. For example, we might get more input from people who are not as comfortable using these kinds of survey tools. And I think the last point too is that sometimes people are skeptical about responding to surveys. You can tell them that the information will be kept confidential and it will be anonymous, but there are people who do not trust this kind of information when it comes over the internet, and they just won't respond. So all of those reasons are reasons. So it's
Yeah, and it's an important distinction to make, because when we talk about how do we implement services effectively, a lot of times people think just sending and emailing people means you're effectively, implementing services and sending out information. That's always the case, because the more email you send from a single sender, the less likely the person is to read it.
exactly.
So you have to keep that in mind too, and especially when you see something like SurveyMonkey that looks like similar mail advertisements you get via email. You have to make a distinction, which is why I think one of the takeaways for this, and we didn't necessarily have this to the extent that we'd hope for, having actual elected officials promote the survey and having people in the community say, hey, when you see this, it's not spam, it's important, please do this. And as much as we went out and we advocated ourselves, I think that's a key takeaway. If we really want an overwhelming support for this, we have to have a huge social media push as well as a push physically in the community.
Yes, and Richard, I would just mention too that it points out the fact that we still have to realize that this is just one method of gathering information, that it's only going to provide us with one aspect of reaching our consumers, and we always have to keep that in mind. I know Susan had a comment.
Yeah, I'd also just like to share that I think that sometimes people who receive surveys get surveyed to death. Because these things are anonymous, they don't really know what the results were of the survey, and they don't see a change in the services that they want with the kind of speed that they would prefer. So there is not only this trust that it won't be anonymous, but there's a sense among some that it's really just a waste of my time. Nothing is going to change for me. So what does it matter? And communicating back is a very hard thing to do. And I'm not judging us for that. But oftentimes it seems that what we do is we survey, then we survey more, then we evaluate more. And it takes us a very, very long time before we make any change that affects the people. And I think we have to be just aware of that. I think it's a good survey. It's useful. It has limitations, but it gave us information that I think can help us move forward.
Thank you for that. And
This is Kyle, and I had a brief question too, if I could. And if you clarified this before, and I missed it, I apologize, but I'm looking at the respondents by zip code also, and it doesn't add up to the 484 responses that you got. It's probably about half, just quickly looking at that. Is that because people just did not provide a location?
I think for the most part that the response was a forced choice. So when it came to zip code, they had to put that information in. So I think this reflects more of perhaps the data that might be missing. And Ann, I know you compiled this part of it. Is this everything? All of the response? It looks like some might be missing though.
It's literally about
I think
half. But
I have to go back in and look and see. I'm not, and that is a good catch, Kyle, because I didn't go in and add them all up. And I'm not sure if I just took the top ones or and then missed some of the lower zip codes. So we will go back in. I'll go back in and correct this slide because if everyone had to put something in, correct?
Yes. For the demographics, we asked you had to respond to each question.
Yeah. So I will go.
It looks like you had about 100 upstate, 100 in Kent, and then 50 and 40,
right.
50. Yeah.
So I'll go back in and take a look at what I missed on this. That was a great catch, and thank you for that. I appreciate it. And
Sure.
so that was probably my error, just pulling as I went through. Even for the others, I was pulling the top data, and even on the word clouds on some of the gaps, I tried to combine some things together so that it was a larger number to tease it out versus a smaller. I may just not have pulled all that up. Thank you.
And I think
Sure. And just wanted to, point that out. You have enough things to look at. And so thank you.
I appreciate it. Thank you very much.
And it may be that we just show the listing the way you had it before, and you show the listing and put the larger percentages where you had the most responses on the map. I know we had it a couple of different ways. Thank you. I think we can go to the next slide.
One thing I wanted to mention real quick, because it brings up a good point about this, and I mentioned this a little bit in the last meeting. Well, we put a lot of time and effort into this survey, and one of the added benefits that I don't think we kind of discussed is its reusability. Just because we did this survey now, and we're going to report the results, and yes, we did not get as many responses as we wanted, but one of our recommendations could be that the department adopt some kind of a standard feedback survey on all services and consumers. And then at the same time, we can, rely on our friends like Senator Poore and her friends in the General Assembly to promote it and say, if you don't do any other surveys, do this one. It matters because we listen, we take this information. So just because we're going through this now doesn't mean this has to be the end of this. This could easily be a ongoing feedback process that's adopted as part of, email and electronic communication for the health department as a whole. So let's also keep that in mind too, that while we've got some great conclusions, I would love to be able to build a data bank of this and see how this actually improves or declines over time. And that's where we'll really get some power out of it. Apologies, Dr. Williams. I just thought that was important.
I think that's an excellent point. And what that does is if we could think of this as benchmark information.
Exactly.
It's the first set of data that we're getting. And then we go back out and we would ask someone else to follow up and do the same thing, same questions, and then see how we're doing. this helps to address the concerns that Susan raised, that it gives more confidence to responders and future responders. And that way, when they see that, oh, they're monitoring this, they're looking at it in different points of time, maybe I'll participate. So it starts to build confidence and trust. And then maybe we have direct responses as opposed to relying on the nonprofit organizations to identify and get people that they serve to respond. So it increases the confidence and ultimately the number of people who respond. But it's something that could be tracked over time, and it would provide us with a tremendous tool there. And the other thing that it does, and I think the initial intent of the survey was to see how the barriers, how the gaps, looking at this again as a gaps, kind of a gap study, how these gaps, access and barrier questions, how did these map with what the division directors told us when we met with them? So there's always a delta between what management thinks is actually happening versus the experience on the ground that we know is really happening. And so to be able to look at these from both ends is very important. And that was the intent of us having the survey and all of our committee here weighing in on what the questions were that we really wanted to ask and why we were going about this in the first place. So I'll just move to this gaps and services slide.
Dr. Williams, before you do so, I just want to comment on what you just said. I do think that that's critical, the delta between policy and practice, because as you said, there were a lot of DHSS employees who may have been frontline folks filling this out. And so that gap, and that we are doing a gap analysis, as you said, with this survey, that the division director reports to the committee, all of those long meetings and what was there, that is a fertile ground for us to identify also a gap analysis.
Yeah, and I thank you for that. And I just thought of something too. Ann and I had a lot of discussions right at the end of this survey. And you may recall when we did this, it was right at March, right in the March timeframe, right at the sort of in the middle beginning of the whole pandemic. And what we said was, oh, how does the pandemic affect us? So most of the respondents were prior to the pandemic being actually identified. And so what we know is if we were to go out and do it again, how would it change? We know that there would be some change in some aspects. So this is a point in time. Going back to what Richard said, we're measuring how people, what their opinions are at this point in time. This was March of last year, 2020. How would they change if we were going to do this again? And that would be important for us to know. So,
Dr. Williams, I'm sorry to interrupt you. Senator, I don't think you can see Senator Poor's hand raised on the side of your screen,
oh,
but
no,
she joined us.
Hello, Senator Poor.
Hi there. Good morning, everyone.
Good morning.
If I could just add a couple things as well. So, of course, first, I'm going to thank everybody for always attending and giving feedback. This is huge. I do want to recognize a couple of things. One, the pandemic does not change the needs of this department and into these divisions, right? If anything, it should show us that while they are stressed out and they are focused on this, there's still a whole nother population that is not getting the things that they need. And part of it, again, goes back to the communication. So I do like the idea of us using this as a benchmark, but I would like us to also think about, as we're writing the report, they didn't need to pay us $500,000 to do a strategic plan for them. We're actually doing for them all for free. And so we need to take some of these things that are coming out as we're discussing this. And Richard, to your point, I absolutely positively believe that there needs to be some type of structure after this committee puts their recommendations in. And if we need legislation, we run the legislation. But once this disperses, that they need to look at this as their strategic plan, because we've done all the work for them. And we have lined up exactly where the deficiencies are. And yet we've only just tackled, a couple of layers. So that's how I would look at it. I would also like to say that I spent time this last weekend helping with the vaccinations at the DMV. And ironically, I worked all day long with the deputy secretary. So I felt like, oh, okay, well, she's gotten a little bit of time with me, right? She knows I'm a worker. I wasn't sitting there. No one certainly knew who I was with a mask on, right? So it wasn't like I was there for a political, like, hey, look at who I am. I was there to help as much as I possibly could. So I was frozen to the core and using the computers and getting stuff done. So at the end of the night, when I said to her, by the way, I'm Nicole Poor. She goes, I know who you are. And she never looked up at me. She continued to write. And I said to her, right, I'm the senator that's working on the task force. She goes, if you would only consider, and I'm ad-libbing, but basically this is what she said to me. We work very, very hard. And I said, well, thank you for your work. We're not talking about work ethics. We're talking about delivery. So sadly enough, there is a negative feeling that this is about aimed personally at people. So I will mention this again in a larger meeting, because if anyone is confused, this is not a personal issue. This is a systemic issue within our state that we need to do better. And there is nothing wrong with us asking for our departments to do better. So I just need to say that. And, again, can't thank everybody enough for your time, your thoughts, your energy to help us do better. I'm good.
Could I add one little thing? This is Kathy. I think it's very interesting, though, just to follow up on that a minute, that when we did the gaps in service, which I think we're going to next, it talks about the public health system not as strong as it should be. And for Pete's sake, if there was anything that could support that statement, it might be the response that we've had to the pandemic. So I just think, pointing out that this was done prior to all our involvement with vaccinations and testing, et cetera, that there was already probably likely within the system as well as outside the system in the community, a sense that the public health system was not as strong as it should be.
Absolutely.
Well, and I think, and I can understand. So let me just to play devil's advocate. There's a saying about flogging the wounded and about beating up on people while they're already, beaten down. And that's not what we're doing here. And I think maybe people are just a little burnt and maybe that's why they're feeling it a little bit too. But to Senator Poor's point, nothing about this is personal. And a lot of it is we're looking at how do we help the employees do their jobs better, more effectively, do the repetitive things less. That's a clear focus of this too. And part of that is ongoing process improvement. Simply not providing feedback because someone's had a rough couple of months is not the right direction. I think that's what Senator Poor is trying to say. Even though we can all acknowledge the pandemic's been hard, we've had to adapt a lot. At the same time, it doesn't give them a pass for not being prepared for it, etc.
I couldn't agree more. I think that the recognition, in part of the, we certainly don't want to pile on or to criticize the work that folks have tried to do and have been doing as best as they can. I just think that understanding that prior to this, there was also already an understanding within that system that the base of that system was not as strong as it could be.
Absolutely.
I think that's an important point. What do you think, Devana?
I do think that, and it goes back to an important point that Senator made about strategic planning. This survey was designed to provide the information. One of the first step in strategic planning is information gathering. And when we all met, we had determined that the information that was gathered from consumers was very narrow and limited to a small group of people and organizations who were asked to provide input. And it didn't really get at the consumer or give us a broad snapshot of what was going on. So this is really information gathering. And then we are doing an assessment through a gap study to find out what is actually missing. And so language is everything, how we communicate is everything. So communicating that, going back to the department, where people are feeling like we're attacking, that's really not the purpose, as the senator said, that's not the purpose. It's really to fill out what was truly needed in helping us understand what the current state was at this point in time that we did the survey. So, and we see the weaknesses, identified a number of weaknesses, and then again, it should be seen as this is an opportunity to really make this right, as a continuous improvement. So I agree with everything that's been said, but it goes back to how, when we write our final report, how we frame these things. So I think everything that everyone's been saying so far, these things should be captured in how we write this up. And I know Maria was trying to get a point in there, and now I see her screen's going dark, but Maria, oh, there you go.
No, you just said exactly what I was going to say. Is it to get to the senator's point? It's how you write it. This has nothing to do with. It depends on how you write it. It depends on how you bring the report out. Because people's feelings are still going to be heard, but we need to make sure that we speak about systemic change.
Yes.
And systemic problems, and not individual problems.
And
so it's all, you said it well. You said it better than me anyway.
And Maria, if I could just also add to that, right? So yes, this is going to be how we're writing it. I'm not going to invite anybody over for dinner, to be quite honest with you. Now, if you call me and you say, hey, Nicole, you want to go to dinner, we're going to do it, right? But when we write this report, I'm not looking to make any more friends. What I'm looking to do is to help our system, to Kathy's point, make the foundation stronger because it's weak, right? And so we know that because that's why we are where we are today, right? I am proud that our secretary listened to some of our suggestions, right? She added 2 deputy secretaries. That was something that we talked about. The department did not need to pay the amount of money that they have paid for consultants and for strategic plans that is still sitting on the shelf. I think everybody remembers me saying strategic plans, they get written, and unless you implement them, they go on the shelf, right? Now,
can I also make a point, Senator Poore, there? Speaking as someone in corporate America, strategic plans are not your only job. I'm asked to do strategic plans every day, every part of my job, and I'm expected to update them throughout the year. The fact that we just take these strategic plans, pay a few $100,000 for them, basically for a PowerPoint and a handful of Microsoft project documents, and that's it.
Right. So what with this, we're going to take this, and in our reports, right, it's basically, we can call it a strategic plan. I don't care what we call it, but it is going to be an outline of what they need to do. So if that does mean, I need everybody to think openly about this. If that does mean that we need to move some of these divisions, if that means we need to break it up to offer better services, we cannot be blind. Like, I need us to go back before the pandemic. I need us to think about how we all came together and why we were here, because we knew, and again, we're not even touching half of it. I've had calls with visually impaired people. I've had calls with people who are deaf, like services that they're not getting, places that we were supposed to move people. The Office of Childhood Learning, that I wrote a piece of legislation. It took us 19 years to get the legislation through, and we still haven't moved that division. Like, there are things that as soon as we do it, they need to respond to it. And we can do small tasks with larger tasks. And Maria, I appreciate you actually making it, saying what I didn't say, which is, it is the way we write this that we will get the most rewards. But keep in mind, I'm willing to take this, and I'm going to take this as far as we need to go in order to make sure that people get the services that they need. And at
If
the
you
same
need somebody in your back, I'm right there behind you.
Thank you.
My people suffer tremendously.
Thank
Still
you.
today.
Can I just say something? When I
Yes.
was working in Maryland, I worked with the governor's office to do a lot of systems reform in terms of human services. And one of the things is we have to understand there are incremental steps that occur when you start reforming human services. One of the things that is most attractive that I have found is if we design some pilot programs in each of the 3 counties in Delaware that are going to do a service integration model. There's some models across the country. I've looked at some funding opportunities from foundations. If we kind of move forward from looking back, but let's look forward in terms of coming up with some solid, scientifically proven recommendations to how to help the state move forward. I think there's enough history there that we can do that. So I guess I'm looking forward to the future as opposed to looking back.
Bennett, thank you for that comment. I think we'll engage that during the conversation of a path forward and how each of the members contribute towards developing their recommendations for actions. Devonna,
I understand. I guess I was just trying to be more positive, thinking of
yes.
Keep looking back. Let's look forward. And
appreciate it.
There's some wonderful opportunities that we can do as residents of Delaware.
You know what? I really appreciate that. And frankly, just the incredible work that you've done at the Rehoboth Resource Center, not getting any state funds and serving 62,000 people last year were amazing. Dr. Williams?
Okay. Lot of conversation there. I'll just add 2 cents on strategic planning. This portion is one part of a strategic planning effort. So if you look across at the 4 committees, that does make up a lot of what a strategic plan would actually look like. And to Richard's point again, this is strategic planning should be an ongoing process. It's not a point in time you're in, you do the plan, it stops. It's a guideline that should be followed. So the gaps in services identified by the survey, no surprise, population cohorts are underserved. You can read the comments next to that. Service needs, Kathy had already highlighted that. Delivery and access, this is no surprise here. Long delays, waits on the phone, multiple appointments, lack of accountability, certain geographic areas underserved. Communication, this was an issue that was identified and an issue that a lot of us have experienced, but and divisions actually recognize. So the stovepipes between divisions, communication taking too long, lack of effective communication, staffing issues, training requirements and needs, and more staff training to take the extra step and to be more consumer friendly. Learning other service resources to be able to achieve client outcomes was a big response. The systemic fractures and breaks, this is important here as well, especially accountability and follow-up, the safety net issues. And the last item, values and organizational culture, developing a clear vision of the consumer and client's needs. And this is a longstanding problem. And I think it was also recognized in the DHSS and their strategic planning effort that there does need to be a change in existing values and organizational culture. Next slide. So here are the barriers that were identified when it comes to access to services. Then the big red bullets, awareness and communication, people not always knowing what questions to ask to get the best services, and the lack of consistent information on what is available. Transportation, this is something that we've all talked about. This comes up in every survey, in every focus group. Agency offices are not located along the bus route. And when it comes to people who are blind consumers, that's a particular barrier to access as well. Requirements and eligibility. This is something that also comes up. People who are on the edge, eligibility wise, for just a small amount of income are bumped out of the system for service. Service delivery, again, this is the difficulty that people have navigating the system. Staffing, unqualified staff, no agency oversight, no service standards are among the things that were looked at here or came out. Personal obstacles to consumers, language, fear, undocumented. And this has come out in other information that we've looked at as well, and fractures. This last point here, that services offered are at the convenience of providers rather than recipients, and time and location are not adequate. So not meeting the needs of people who are shift workers, for example, would fall under that. Inadequate numbers of skilled workers to meet the needs of consumers.
And I think Dr. Williams, if I may say, I think it's important to note in the identification of the gaps, barriers, and obstacles that these quotes here are actually the words of the respondents themselves, where we've teased out the coding of them and the categorization of them, but the quotes themselves came from the respondents in their qualitative statements.
Exactly. Thank you. And they're quite revealing, and we attempted at the beginning of this to kind of summarize for each of these what the overall response was. Okay, thank you. Next slide. So here you see obstacles in accessing services. I'm not going to read through all these quotes, but you can see with different populations here, the elderly, visually impaired, undocumented, homeless persons, people with behavioral health challenges, and so forth. Complex medical needs, these are different populations. People having difficulties or obstacles in accessing services. Service delivery, we had already talked about underserved areas, the hours of operation and long waiting lists that people encounter. Transportation, again, transportation is another obstacle. So it's an obstacle, it's an access issue, and it's a service issue. Staffing, again, comes up on all three of these of our assessment areas. Just not enough staff, as we know, and we heard that from our division directors. Communication, problematic website. I tried to navigate the website a couple of days ago and I got lost still.
I wanted to also make a point about something. So I looked at about 7 or 8 different states and their websites. I just Googled state health department, click on the first link. Okay. What I've noticed is on other sites, you can easily find an org chart or a list of programs. On our site, you get a list of departments that are completely disaggregated, and you have to play department roulette to figure out who actually has your services. So, I mean, that's an important distinction. Like, I know at the beginning of this process, we'd asked Dr. Walker for a org chart, and we got one that was like a year old, and it wasn't even inclusive of all of the departments. So if you can't even articulate what departments and divisions are in your own organization, how can you effectively deliver services to consumers? I mean, that's like website 101 for an organization, in my opinion. I know I'm a little overly critical here, but it's because I expect something that can be generally accessed. And New Jersey's is pretty bad, but it's still better than ours.
And I think that goes back to, I know when Ann and I had conversations early on, we talked about this being really focusing on service delivery from the consumer's point of view. And so when we go back and you look at the values question and culture, the culture has been this kind of hierarchical organization, but the consumer doesn't care what the division is. Consumer doesn't care who the consumer wants to get the service. So from a consumer standpoint, you want to know what are the programs and services I qualify for. So I should be able to go on and type in, I'm this type of person, where do I go for this? And that should come up, not go to this division and then you find out it's not in that division, then you have to go to another division. So that's part of the obstacles. So when we look at obstacles and we see fractures and breaks, for example, that again comes out, you got high costs of healthcare, we have communication issues, staffing, service delivery. So these things that came out are things that are real obstacles for our consumers to receive the services that they need. And the website, reflects the way the current service delivery is. I won't say always, but it's reflective of the way the organization is set up now.
I wanted to also, if I could, one suggestion here. Senator Poore, as you're aware, there's a bill that's being put forward in the legislature right now to add mental health units for our schools. This is one of those things where when we're looking at increasing access to services, access to mental health and awareness of services within the Department of Health, would be part and parcel to this. And if we're looking at how do we serve populations, schools are a good access point for that. So instead of doing one behavioral health unit for every 250 kids, knowing that they're actually going to be serving 250 kids and 400 parents, you might want to think about maybe reducing that number. Because if we're looking at providing, end user access to services, having someone locally in a school might be more approachable than having, them try to cold call people, because a lot of people are scared of doing that. So that's just one way where we can connect existing legislation to resolving some of the concerns that have been brought up.
So let me just touch quickly on that. I'm actually a co-sponsor of that piece of legislation. I believe in it wholeheartedly. Wraparound services are key. We should be more of a proactive society versus reactive. And so what I would say regarding that piece of legislation, it has taken Representative Longhurst years to get to where we are today. And the reality is that it's actually still underserving a large population, but it's one step forward. But we could, in a way, wind that together, but sometimes we still do things backwards, right? So this is going to fall under the Department of Ed versus our DHSS side. So, but that's another whole conversation for another time. But yes, it is a very important piece of legislation that we need, especially more now than ever.
I was just using that as an example to talk about the problem holistically and how you can connect legislation, even if it's might not be intuitive. There's ways to help everyone.
Can I just mention that the Johnson Foundation has provided funding to states for school-based health centers, which would include health and mental health. And so if Delaware decides to move in that, there's some funding coming from foundations that would support it. Because I've used it and I've gotten funding from them, the Robert Wood Johnson Foundation.
There are also a couple of other foundations, and actually I was going to give some calls to some folks in New Jersey that have supported similar projects in other states. Might be able to cut the cost for the state of Delaware.
Okay. All right. I guess we should resume our slides then and go to the next one. Continuing obstacles to access or inaccess, red tape, staffing, and values and culture. And again, I'm not going to go through all of this, but you see these are where we got some major response. And next slide.
And I think that is the end, and that I have not put in a conclusion because what I wanted to do, and Devonna, Dr. Williams, I want to talk also with the group, as you see this data, and I've sent you a preliminary draft report that when we talked informally before, we had talked about looking at the word cloud and the list of services and to not miss those data elements. And so I sent a draft report to everyone to augment this PowerPoint And then we need to create the last slide. And recommendations on how we do that. I didn't make any summary conclusions. We wanted to present, I think, Dr. Williams and I talked about just presenting the data as it was to the group, and then extrapolating from there, as we said, a guide for further study, or just some clear-cut recommendations that we can make as you glean from this data, as well as you glean from the division director reports. Does that sound to Devonna, in your as a path? Would you tailor that anyway?
I think that's a good path forward. When because this was a qualitative, we had all these 400 responses, and we did word clouds. We thought that it would be easier to share and more visually impactful to be able to share what that actually looked like as part of the report. So it wouldn't be all the word clouds, but it would be a few that are very telling of how people responded. So yes, I think this is a good path forward, and we should ask everyone here what your thoughts are as far as going forward. We had a lot of good dialogue today about how we should frame and the language that should be considered as part of the written report.
And so as part of the PowerPoint, I am going to pull in the word clouds, and I'm going to pull in the list where, and in your draft report, it's not going to add up into saying 496 respondents, just so that you're aware that the Survey Monkey, if somebody mentions, for instance, services or lack of services, and that counts in their response. Later on, they might talk about transportation. So there is it isn't correlated to one respondent, and this is what they said. It is topical and thematic in nature, the word clouds. And so the listing of services likewise are not going to add up to 496 respondents. We will put those word clouds in and condense them, as Dr. Williams has said, in terms of gaps, obstacles, and barriers. But as we get to the end here, we need to put in a conclusion, and I think in terms of a guided path forward, and we had some good recommendations today. I think that the minutes will surface. But likewise, what I would like to request everyone to do at this juncture would be, looking at the rubric for the coding, which we created, of values and culture, staffing, fractures and breaks in the system. If there's another code that we should have extrapolated up, once you look at the word clouds and you look at the report that we have sent, then I would like that you, suggest that we add that if we've missed something here. And also ask that you make recommendations similarly than what you did with the division director reports. Some individuals have gone through their division director reports and sent in their recommendations. So we're still asking everybody to go back through all of those documents that we received and to bubble up what you're teasing out as your recommendations from the vantage point of where you sit in your own perceptions. So if that works for this, so this is the PowerPoint is a work in progress. And a draft. Obviously, I have to correct the zip codes, but other input from everybody is appreciative in terms of developing that last slide of a summary and conclusion of next steps. And I think we had some good ones today from pilot projects, as well as taking a look at creating benchmarking. So Dr. Williams.
Yes, and Dr. Farley. I was just thinking as we were going through this, that it might be helpful once all of you read the draft that Ann has put together. You read the draft and then maybe write up a couple of conclusions that you reach after reading it, and then share that with Ann. And then we can look across all of the responses and see if there's what's the consensus on what is the conclusion here? What are we saying? You know, what is our finding? I mean, I know, I have some sense of what I think the conclusions are, but Ann and I are both closer to this than the rest of you. So after you've read it, then write your own couple of paragraph conclusion. I think that would be very helpful to our process and to seeing what the consensus is amongst the group of what we actually learned and what we need to be able to share. Does that make sense, Ann? Is that, you think that?
Yes, I think that's great. Is that okay with everyone? You can just wave your hands.
Okay.
All right, that sounds good. Thank you, Dr. Williams. I really appreciate the very rich dialogue in your presentation and everybody's participation. And I have to say, I was talking with another member of our subcommittee, and I was just talking about the richness of our group, the diversity by which we come, and just how we've gelled and we work together. It's just been very uplifting, and listening to the dialogue as we went through this was really helpful for me, because I got a really myopic view after being entrenched in the data. So it was really nice to hear everybody's input. And so with that, we are going to move on to the next item on the agenda, which is a path forward. And so, and how do we get to our report, generating that, and what we need to do. And so at this juncture, we did not do public engagement. We had relied upon DHSS for that. And I think when we were talking informally last time, we felt that with the division director and with this data here, that this was sufficient to roll up some recommendations. But one of the recommendations would be that we do engagement with constituents, that become one of our recommendations, as well as to capture outreach to populations and groups that did not enter, that weren't into the survey. Despite our efforts with the outreach to the Hispanic community, we might have to do a different form, because we only received, I think it was 3 version. That's not to say that persons of Hispanic, Latino background did not complete the survey. They may have opted to do it in English, but we received 3 individuals who responded to the Spanish version of the survey. And so is everybody still of the same ilk around that regarding public engagement?
Yes. Anne, can I just say something to this?
Sure.
You know, and Taylor can speak to this. I ran a task force, and we're reestablishing that as well in regards to guardianship. Okay. And I want to make sure that I say this to this committee, because I can't remember if I did or I didn't. I'll say it again in a larger format. If we can find ways to help the department do better through recommendations, that's great. But if we feel that the recommendations are not being heard, or we think for 1 second that it's going to just sit on the shelf, then I will run legislation. So it would be really nice that when we get this report back, I would like to have time for the department to read through it and say, we can hit this, this, and this. And I want it in writing to say, this is what the timeline's going to be. Because if not, then I will be back with legislation. I'd like to be able to do this before we come out in June. And I realize that that's a very long, tall order, but I'm always about compromise. I'm always about being able to letting someone do their job. But if they can't get there on their own esteem, then we're going to mandate it. So I just need you to be thinking about that. So if you're writing the recommendation that, hey, they have to do surveys, and also let's not for nothing, let's dummy this down. If they have to do surveys, then how are they doing it? So please think a little bit further in that it should be done quarterly. It should be done through Monkey Survey. It should be done like whatever it is that we're thinking. Let's even, bullet point that so that way there's no going back like, we couldn't do it. Don't know how to do it. Because if it comes down to we don't have the funding, oh, okay, well then we'll figure that out. Right. So that's the stuff that I would just like us to dig down into, not just, this is just a report. And maybe what it is also, let me think this through. Maybe what this is that, these are the recommendations but this is what should be done in legislation. That may, because again, when I had the conversation with our cabinet secretary and I said to her, you didn't need to pay all the money that you paid. We clearly told you you needed to have a second deputy and you did it. So, some of these things are just them being able to see a bigger picture.
Thank you. Susan?
So I have a little bit of a different question here. We only survey DHSS, but there are other departments such as the Children's Department that overlap with DHSS in marked ways. And I would like to suggest that we consider whether or not in the future that these surveys that we have of consumers on a regular basis, that we include other departments in those surveys. I don't know what you would think about that. It doesn't seem really judgmental to me to say that we want to make sure there's organized consumer feedback from all the relevant departments in the state so that we really do the kind of job that we need to do. So just for consideration.
Susan, and thank you. And the survey did reach out to other departments. We did get some respondents back, maybe not to the level that we would have liked, but I know we did outreach to housing, kids department, and several other. Kathy?
Yeah, I want to add, Susan, I appreciate your I appreciate your comments so much. I have been throughout somewhat concerned because, and I'm not sure how to get at it, I have to be honest. There are so many points of intersection between the kids department and DHSS. And quite frankly, other states, other places have been able to certainly do, in my opinion, a much better job of the kinds of transitions that need to occur and the supports that need to be in place for those services to continue to as they age up, provide the newer services that they would require. And the other piece I want to be real clear about is other states have been extraordinarily successful in bringing in a great deal of Medicaid money, frankly, to support a lot of the services through the transitions. And as I said, I'm hopeful, and I appreciate so much what Susan said. I think she and I often look at things in the same way and have many of the same concerns. But I have been concerned. I am concerned. I am concerned about the aging out population from the kids department, as well as the services, the breadth of services that they receive as they're part of the Children's Services Department. And I don't know how to get at that, Senator Poore and Ann and Devana and others. I don't know what if there's a place in this committee to at least raise that issue or to put that on the table, I certainly would be appreciative and think it would be helpful to the children and youth in the state.
I think, well, it was surfaced, that was a big theme in the response is in the survey, the transition and the gap thereof. And your comment on, and it's also on Medicaid and the use of social determinants and support services that can be funded by Medicaid that Delaware has not done. And so, just from we are behind I mean, I think now they're talking social determinants a lot, but other states have been way out in front on that and using Medicaid for those supportive services from anywhere from the population you're talking about to persons to try to sustain independent living. So I think those would be important as we're talking a path forward to raise. And at this time, during this discussion, we're really starting to talk about how do we move forward to meet our timeline. So before we get with all of the recommendations, Taylor, if you would take a minute and just walk through the group formally as to what we need to meet.
Taylor, before you do that, I think Senator Poor has her hand up.
Thank you, Alexa, for catching that. I appreciate it. I'm not so good at all of this.
No worries. All I just want to say to Kathy and Susan's point is that we can put anything in recommendations. And I'm going to reflect back again to another task force that I have. We could have been done with what we did up to the certain point, but what we found is sitting at that table and building the relationships that we built, and truly built some really solid relationships from the hospital system to the nursing home system to the Medicaid department, that they were willing and are still willing to continue the conversation longer because we identified things that are not right with our system. Some of it was handled right at the table right then and there, right? Simple stuff that because people didn't know who each other were, they didn't know how to work through some of these issues. And so I think it's important for us to raise in the recommendations that, these are topics that have come out and that we need to have a focus on them. So we can either do it collectively sitting at a table or we can write legislation. And I hate to keep going back to that, but the one thing that I'm super appreciative of when I first started this was that it didn't start with a task force. This whole idea started because I wrote legislation. I wanted a change immediately. And one of the best things that happened is that we didn't make those changes. That legislation never did make it to a committee. What made it to the committee was the task force and the creation of this. So Kathy and Susan, I think we should be adding that into the recommendations.
Okay. Thank you.
So I will move forward with the timeline for both the subgroups and the committees. This subgroup is definitely on target for December and January. The goal was to review and analyze the data collected and identify any additional data needs, which I believe definitely was accomplished in this meeting. So February, the subgroups can meet as needed in order to continue to take that data and turn them into recommendations. In March, the committee will meet again to give subgroup chairs feedback on the proposed recommendations. And then after that feedback's received, the subgroups will hopefully meet again in March in order to refine those recommendations. The goal is to have the committee vote and accept the final recommendations from the subgroups during an April meeting. And then the goal from there would be to have the final report drafted in May and sent around to co-chairs for their approval. And I believe I shared this with everyone following our last meeting, but I'm happy to answer any questions, and I'm sure Senator Poor is as well.
Well, Taylor, you did. Oh, go ahead, Susan.
Well, I have a personal question, and I had said I would go through all the minutes.
Yes.
So looks to me like you need that done by mid-February at the latest.
Well, a little bit before mid-February.
Okay.
Because what we need to, so as Taylor talked, and this has been a very robust group, and we do have recommendations that it really surfaced in the minutes of various meetings that we've had, some really concrete, solid recommendations. We need the group to go over those, vote on them, and be like, okay, I accept this as a recommendation, and to move forward, because I don't want to move anything forward without and the method we're going to use is a consensus versus a majority method, because I believe that's the most inclusive way, and procedurally, rather than everybody vote, that we come to consensus. I think we want to be in agreement as a group with what we did. And to that extent, if somebody is not comfortable, for instance, Maria, I don't mean to single you out at this point, but, Maria has been a vociferous voice and oftentimes a lone voice for undocumented, for services to Hispanic, Latino community. And so if we did a majority vote and Maria felt compellingly strong about an issue, and everybody didn't vote for that, so that's where I am, that we go to consensus. If somebody's very passionate about something, I'm going to ask that we all open up and are respectful of the recommendations that people are making because of the passion in which they feel versus the research that they've done and what they've heard and seen. And just procedurally, I'm suggesting that. Does that sound like an okay path forward? It's not the most rational, Richard, but does that sound agreeable? I think
perfect sense.
Okay.
The passion guide where the solutions need to go. I'm fine with that.
Because the other thing I want to say is, Richard, if I may single you out a little bit too, and we have a very diverse group, is that your analytical nature is one that we have benefited immensely by. And not all of us are coming from that perspective. And so I think you've teased up some incredibly good recommendations that frankly, I think that I was blind to. And so that I've been really enlightened by the nature in which you perceive and see issues. And so I value everybody's input, and I want to make sure that everybody that has a very strong ilk for a recommendation, that we are including that in our final report. So to get there, Taylor, if I read this right, we need to have something done by the end of February, would you say, in terms of our preliminary recommendations?
Preliminary, yes.
Okay. So in a path forward, do I hear, so the path that we have asked to get to roll up recommendations are twofold on each individual member: to go through your division director reports and the secretary presentation, to roll those up as a series of recommendations and then share them with the entire group, if you would, because, and then to also go through the draft report of the survey and as well as the PowerPoint, and then tease out from that, as well as our discussion recommendations. So there's 2 data points that you're going to be making recommendations from. I don't want to move forward with another meeting until we've done due diligence and you've had time to do that. And to look at any other data, things that you have, such as independently, Richard, some of the things that you have looked at, which has been the other websites. Kathy, you're looking at public health issues across the board and processes. So I know, Bennett, you've been looking at some best practices across the country around service integration models, person-centered approach. And many of you are on other committees. So I don't want to limit all of our recommendations just to those 2 data points, but those will be the core of what we do. Does that make sense to everybody? Feedback? Discussion? And we'll do discussion. Everybody's good. Go ahead, Kyle.
When do you want that information to get back to you or Taylor or?
Yeah, I would like just if you would share with the group. So what your thoughts are, what is a reasonable time frame for you to be able to do this? Can somebody suggest a date? That's what I want to work through, a time frame here.
Is 2 weeks? Does 2 weeks help?
Okay, so if we get it by February 12th.
I think that's reasonable.
Yeah, I think that's reasonable.
Okay. And then and then we would work to synthesize that into a document, because there might be duplications. But if you share with everybody along the way, once you get done, then you can, I think that would be helpful. And then we would meet to go over recommendations. I would then have to get a synthesized report out to everybody. And we would meet on, I guess, the following at 19th. That gives us a week. Where we would really look at, I would get a report out to everybody on recommendations, and then you would look at us looking at the 19th as voting on them. Not voting on them, but you know what I mean, discussing them and coming.
And who do we send it to? Is it Taylor?
Myself and Taylor and Senator Poore, who is co-chair.
Okay.
I don't know if everybody would like to see everybody else's at this point. Would you like that, or do you feel immersed? No. I don't blame you.
I would say no. I would say no, just because what it does is it influences what you might write. And so what we want to do is we want to get everyone's individual perspective. Then you consolidate it and see what are the converging ideas, you know, as a process. So, you know, out of all of our group, everybody's in agreement on this particular thing. So we know that's definitely conclusion. So that's what we want to be able to do. So it just keeps it more objective and a subjective objective process, right?
That's a good catch. Go ahead, Kathy.
Trying to make your life a little easier. Is there a particular format that we could, you know, put it in so it would be easier for you?
Yes, I think Richard had a format, didn't you, Richard, way back when?
So I sent out just a Word document with the format, and I just threw some data in there, like links to the existing PowerPoints and stuff like that. But you can use that format. It basically breaks it down into like observations, recommendations. The only thing is when you're drafting up your responses, I think for Dr. Farley and whoever consolidates it, sort them into division-specific recommendations and general recommendations.
Richard, can I ask you to send an email out with instructions to everyone? And I'm going to ask you to help me because to help me with generating a final report for this.
Mm-hmm. Do you want me to just, I can create an artifact that everybody can fill in real quick, and that'll make it really easy for us to consolidate everything.
Could you send that Word document again? The initial document that you said you sent out, could you resend that to the committee?
Yeah, I'll send it after this meeting. It'll probably be closer to lunchtime, but I will send it out. Yeah.
Thank you. Thank you.
Thank you, Richard. Send it to me too, because I had trouble finding the link for the meeting for this. We just got it last Wednesday. So that would be great. I appreciate that. Thank you. So is everyone, if you are in agreement with that path, just go like this, a Zoom. All right, that sounds good. Okay, so then Taylor and Alexa, we're going to meet again on the 19th. So you have to do that posting. And our singular item at that point will be the review of the recommendations. And so we will get the report out to you hopefully at the beginning of that week. I'll work on it over the weekend after you're going to get everything in on the 12th. So, and then the interim, you also need to, before then, just after this, like sometime in the next few days, if you can look through that PowerPoint and the survey report and then just, well, never mind, just do what we've said and follow Richard's directions. I think that works. Okay, because I don't want to confuse it anymore. Okay, I think that narrows us in. It's really hard because when you put a net out as wide as we have, as broad as we have, for as long as we have, coming back to the core is a challenge. And so I thank everybody for that. At this time, since we're in agreement with those dates, and I think we'll meet our timeline for reporting back to the full committee, I want to go around I would like to go around for the good of the order and give everybody an opportunity to talk. And then if we have anybody that's for public comment. So I'm going to start with my screen the way it is fast. I see everybody. Maria, if you could go first, do you have anything for the good of the order?
No, we'll just wait and see what the recommendations come up. And I'm sure that I'll have plenty to say. And maybe not, maybe we're on the right track. I think if I can say one thing, is that we cannot afford to be complacent and gentle, because this has been years and years and years of the department hearing the same thing. So yes, we have to word it in a way that we don't offend people, but not allowing complacency. And I want to be your friend to get in the middle of providing solid recommendations and holding people's feet to the fire. That's all.
I think that is really excellent guidance, because I want to thank Senator Poor for creation of this task force. I think all of us here have felt a compelling need and a sense of the urgency of improving services to those who most need it. So Maria, I really appreciate that guidance. Richard.
The only thing that I want to keep in mind is I like what Maria said. Now is not the time to be gentle. We can be gentle in the messaging. If anybody has any, if you're worried about how to frame your recommendation or your observation, just put what you feel. Dr. Farley and I can work through and we can ferret it out and find a better way to say it, or a more constructive way to say it. But it's more important that what you felt as much as what you've seen and learned is what comes out of this task force. And like for me, I'm still going to be following up on things like, the IBM automation AI solution, because that could have helped us during COVID. And there's some other things that I want to follow up on related to that. They might not be recommendations, but they may be things that are observations that Senator Poor can then use to spark new legislation. Don't hold back is what I'm trying to say. We'll make the formal messaging, but I would rather see people's raw feelings and raw emotions come out of this, because that in itself tells its own story.
Thank you very much, Richard. I appreciate that. Crystal, and I want to say that I had a conversation with Frankie. I didn't know you were good friends with him.
Yes,
He told you I taught.
Yes, he did.
He told you I taught him water skiing.
And I do have a comment. I want to comment on Richard's comments he made earlier about the reusability of the survey. And
Wait a minute, may I ask people to go on mute if you're not on? Okay, thank you. And just let Crystal speak.
I wanted to comment on Richard's comment about the reusability of the survey as feedback. As I'm speaking from the perspective as a frontline staff worker, I think that maybe this could possibly be used as a perfect tool for those divisions that have staff that go out into the community to use, maybe as in an initial format or a yearly format, to obtain information directly from the clients or the consumers.
I think that's excellent. And I think Dr. Williams can also help tailor that instrument in a way that the language is such that it, is not so bureaucratic. And on the question of access, what affects access, there's, it was really, as we teased through that, the framing of the questions too, we can really work on, because that may have been its own barrier sometimes to constituents filling it out, because it sounded like a little bureaucratic or not. I don't know, so thank you, Crystal. Kyle?
Thank you, Ann. I would just like to say that I really appreciate everybody's efforts, their areas of expertise, the honest dialogue, and for Senator Poor for putting this together. It has been an enlightening, even though some of these things, as Maria noted, have been talked about for years, it's still been an enlightening process. I'd like to hear also that the interaction, or maybe recommendations to collaborate with other agencies. Kathy and Susan, with the kids department, said it perfectly. And I know working with Susan throughout the years in the past, there is a great deal of overlap and issues that could be addressed. So again, thanks to everybody.
Thank you, Kyle. Appreciate it. Bennett? Bennett, you're on mute.
Okay. What I was saying is I've been down this road before in Maryland with systems reform, and I'm very excited about the conversation today. And I'm one that always moves forward, looking at solutions. And I have some ideas about some pilot programs for the state of Delaware, as well as some funding opportunities that I've been researching. So when that time comes, Senator, I'll be glad to work with you to look at some funding opportunities to bring in some model programs.
Awesome. Corinthia?
I would just like to say thank you to Senator Poore and to the committee as well, but Senator Poore, because you are a breath of fresh air in regards to, I believe, your commitment and your passion. And I feel like after so many years, this is really going to get adjusted. I'll write everything I do need to say, but as I listen to everyone today, you each have such great expertise. But part of my thoughts too is that state government does have an organizational structure that also could contribute to some of these issues, but I'll put that all in writing. Thank you.
Thank you. Thank you, Corinthia. Devonna?
Well, thank you. I echo a lot of what's already been said, but the one thing that stands out to me is social determinants of health. And if we focus on social determinants of health, then that forces us to look across all the state agencies that provide services to the consumer that improve or have the potential to improve or hurt their quality of life. And so with that in mind, it's not just DHSS, it is all those agencies that play a role in providing services. And so if we think that way, and I'll have to incorporate that into my recommendations, but I'm so glad that it came up. I think that Senator Poore and all of our committee members, this is an opportunity for us to really shine the light on some things that have needed to happen for a long time. And so to the extent we do that right, it can be a big help to further social determinants of health and outcomes for all people who are all of our Delawareans. So I'm optimistic. I'm like Bennett. I'm optimistic that this is going to, they said my name is Bennett and I'm in it, right?
Devonna, I appreciate that, because what I do want to say that this group, when we were meeting in March with all the division directors, the focus of the group at that time really, we were talking about systemic racism, discrimination, how people were treated. We were calling the divisions, to be accountable for that. And as I read through these minutes, I was so amazed at the laser focus that we had, and and who would have thought what unfolded has unfolded, but it was unfolding then, but to the proportions. And I do like the focus of all of us being positive around the opportunity, but not being remiss, as Maria said, not being complacent. This isn't the time to be complacent or gentle. We have an opportunity to voice, and let's use it. So I really appreciate you saying that as well. Kathy? You're on mute, Kath.
I'm off. First of all, I want to thank Senator Poore for the opportunity and her hard work and good work on these issues. Like Bennett, I have had the opportunity to work first as a consultant and later as the manager of the changes that took place in New Jersey in integrating their children's services. And I certainly am so hopeful that Delaware will take a good look, and I hope it doesn't require legislation. I hope that people do take the words from this work that we are doing and do the implementation that's necessary to bring Delaware forward. There are funding sources out there. There is expertise out there that is willing to help. And I think we just need to assure that our recommendations do move forward. And with that, I think we're so fortunate to have Senator Poor. So thank you very much.
Susan Sisek?
Thank you. You know, I would agree with everything that was said today. And the only thing I would add is that to build on what Kathy said, there are resources available and there are resources in our current departments. When I went through the division director's reports on MLK Day and sent all that stuff to you guys, one of the things that I said is that when I found that when I worked within a department, we never had the money up front to do services for people. But at the end, when everything got really messed up and a child needed something that was exorbitant because we weren't able to do the things up front, we got the money for that. So in the end, we spent the money. It's just like how you spend the money. And I'm not saying that those decisions for those individual kids were wrong. I'm just saying that if we could look at how we fund, how we make decisions. And I had a lot of work, did a lot of work with the people in New Jersey. And, you know, they said to me over and over, you could do this, but you don't have the resources. Look at your cash pot and look at our cash pot in the kids department. And that goes to who we value, what we value, and where we put our resources as a state. And one of the things that I think is good, in addition to Senator Poor and your phenomenal work on this, is that there are other people in the legislature now that would be willing to support legislation and funding to get recommendations done. So we're at a moment in time where we really do need to be aggressive because I think there's an opportunity. Thank you.
Thank you, Susan. And our leader, Senator Poor.
Thanks, Ann. You guys have already heard me thank you, but I'll continue to thank you for all your work and your energy on this. I have a question. I have a couple questions. How many of you live in my district? Just raise your hand. Kathy, you better put your hand up.
What's your district number? I forget.
12. I'm Newcastle. So I
19720?
I am, but I am from Penn Acres, Van Dyke Village, all down Route 9 corridor, all the way down to Middletown. I scoop out some of Bear. Okay.
I'm in Bear.
Yes. We were at Wawa together. So how many of you know who your senators and reps are? Okay, maybe I should have asked that question first. Okay. So let me walk you through some things. When this originally started over 2 years ago, I sat in multiple meetings with Representative Williams. I sat in meetings with other legislators that when we went to the table, it was more than one division sitting at the table for one simple ask. And what I found was those divisions did not talk to one another.
Mm-hmm.
As a legislator, I was frustrated, and coming from the business world, I was frustrated to not know how we could all be sitting at the table and yet no one knew what the other one was doing. So we would leave those meetings and Kim and I would talk about it. And so then there was another situation that happened to come up. And I really felt that, and it really started from the STARS program, which is early childhood education, right? And that is what catapulted me into saying, we need something different. You know, there's a rule of thumb that, you know, a person should only manage no more than 8 people. And then that's how you build your structure. Maybe that's changed over time, but, you know, to be effective, you want to have your different layers. It's not that you want to be top heavy, but you want your layers. And when I looked at the structure, and I actually happened to be out to dinner with 2 people, and I have to leave them nameless, who I was talking through my frustration about how is it that we're so lacking? Like, I mean, we're the government, right? And I know you're probably like, okay, Nicole. But the reality was, I was like, I can't believe we can't get down to just some bare basic services without all of these things happening, or all these multiple conversations, or you talk to somebody and they don't know something. And so we're missing some fundamentals. And originally, early in my thought, I felt that we had a policy delivery person, amazing, analytics all the way, but we were lacking the advocacy. And I know that it is very hard to find all of that actually in one person. And so I thought, oh, well, this is simple. We'll recreate what this department should look like. And if we divided it up and we, in my mind, moved Medicaid out and even made that its separate department, and we, had a secretary who was an advocate and a secretary that was a data person, we've got this, right? It sounds really good, at least in my head it did. And then putting that down on paper, it was even more powerful, at least in my mind. And as we moved through the process of it, I learned that not all of my colleagues were behind it because they didn't understand it. So I went one by one to each of my colleagues, House and Senate, and explained to them, you too have people in your district that are lacking services. Or how many calls do you get that they don't know who to call or how to get somewhere? How many times have you talked to a state employee that says, I have no clue how to do that? And it takes you a week to get an answer. Like, there has to be a better way that we can do this. And so when the governor said, Nicole, I really would prefer a task force, and let me tell you why, I had to take a look back and say, okay, you know what? I hear what you're saying, and I don't need the accolades, and I don't need the press releases. What I do need, though, is a system that serves our folks better than what we do today. And it is not about people personally. It is about us doing it better as a system. And so that was and still is my focus. So the reason why I ask you, do you know who your senator and your reps are? Do me a favor, put a call into them, put an email into them. Let them know that for the last year, you have worked on this task force, and the things that you have heard and the things that have mattered most to you will be coming out in a report. But more importantly, it is with their support that help us make the right changes for the people in Delaware.
Thank you, Senator Port. Oops, go ahead.
That's okay. I was just going to say, I did not do this task force alone. I did it with each and every one of you. So if we are talking about making the changes, it can't just start from the inside. It has to be with what we have done on this outside to help motivate and incentivize us to be better.
Thank you. Thank you very much. Taylor and Alexa, both of you, do you have closing comments for the good of the order? Would you like to have any input, please?
I'll just say thank you all for your patience and cooperation and participation on this, and your patience with both me and Alexa. I will say that we should probably leave some, I don't see any attendees here now, but for the good of the order, can I open it up to public comment at this
Yes,
point?
that sounds,
Alexa,
yes, yes, thank you.
So just to be official, are there any members of the public that wish to give public comment? If so, will you please raise your hand now? Seeing none, that concludes the public comment portion of the meeting.
Great. And so what I'd like to express my appreciation to you, Taylor and Alexa, for your incredible support. Do I have a motion?
And we didn't give Alexa a chance to say.
Oh, yeah, I'm sorry. Thanks, Maria. Alexa, can please give us some input, what your feedback is?
I don't really have much to say besides I don't believe I met all of you guys at the ad hoc meeting. So I'm Alexa Adams, Senator Nicole Boer's new legislative assistant. So as we go further and further towards recommendations and everything, I will be helping out more and more with the task force as Taylor transitions fully into her new promotion. So thank you all for bearing with this transition and for all of your hard work.
Alexa, thank you and welcome. And I was remiss at not introducing you. And Taylor is now the policy director for the Senate. And so Alexa, you'll be charged, I assume, with working with Senator Poor to take all of these reports and generate recommendations, since we want all members to have their recommendations in. And I know that Senator has rolled up her sleeves and she has some very concrete recommendations. So you taking a deep dive through the report and the division director reports, and then getting the summaries to her will be helpful, I'm sure, to her. And so what I would like to do is at this time just say it's a pleasure and a gift to work with each and every one of you. I've been humbled by the incredible richness of the dialogue and the insights that you have. So at this motion, I'll entertain a motion to adjourn.
So moved.
See you in February.
Thank you, everyone.
Thank you.
Bye-bye.
Congratulations, Taylor.
Thank you.